Hi, this is Stacy, and I'll be presenting a patient I saw on Friday the 5th. HM is a 60-year-old single Caucasian male who presents to the office today as a new patient with complaints of shortness of breath and cough. He appears to be a good historian and is accompanied today by a friend who is sitting in the waiting room and will come in at the end of our visit. His chief complaint states that he has been having shortness of breath, bloating, fatigue, swelling from his stomach down to his feet, and coughing for 3 months now. He states back in December, his friend had COVID and so did his children. And his friend told him to go get tested since they play in a band together. He went to the urgent care, got tested, and was positive. After he got home, maybe about a week later, which was the middle of December 2020, he started to have bloating of the abdomen. And then he started to retain fluid from the abdomen to his scrotum, to his thighs, to his legs, to his feet. And it's just been getting increasingly worse since then. He stated that there's nothing noted that there's a trigger except that he was tested positive with COVID. He said he didn't take any over-the-counter meds. He hasn't gone to see a physician, gone to the urgent care again, nor has he gone to the emergency room for this issue. He said he's been having increased bloating, shortness of breath. His swelling has gotten worse. He complains of feeling tired all the time. He doesn't get enough sleep at night. His testicles are swollen, has a rash under his testicles, and has a productive cough. Again, he hasn't tried anything, so he doesn't know if anything has been working for him. He has a past medical history of venereal disease, herpes, rash to his testicles, constipation, and difficulty with erections, no surgeries, no medication, supplements, herbs, or vitamins, no allergies to food, pets, foods, environmental or occupational allergies, family history, no history of cancer, diabetes in his family. His dad did have heart disease, had a few bypasses, and had a heart attack and died at 89. His grandmother on his maternal grandmother did have diabetes, and everyone else was pretty healthy. Social history, he is an attorney. Hobbies, he plays in a band with his friends a few times a month. Living arrangements, he lives in an apartment by himself. He has no spiritual affiliation. He does drive safely on the road, no issues. Patient is not sexually active at this time because he is not dating, but when he is sexually active, he dates women and he does not use any protection at all. He drank, over a year ago, he drank 12 beers a week plus wine, a few glasses of wine. But since a year ago, he's cut down to 1 to 2 beers a week or 1 to 2 glasses of wine a week. He was a heavy smoker over a year ago for about 10-20 years. Then he decided to quit cold turkey last year. He doesn't have any caffeine. He doesn't do any recreational drugs or smoking, no marijuana use or illicit drugs. He adheres to a low sodium, heart healthy diet, he says. He doesn't get to exercise like he used to because of the shortness of breath and the edema. He doesn't drink any coffee, no caffeinated beverages at all. No sodas or anything like that, no excessive sweets. He's due for a colonoscopy, due to go to the dentist. Actually, he went to the dentist 2019, had reconstruction surgery, so he said his mouth is fine. Hasn't been to the eye doctor in many years. Never had a prostate exam done. His last physical and labs were 2019, and he saw a dermatologist about 5 years ago. So he's behind it is in his preventative care. Constitutional review of symptoms. No fever, chills, eyes, ears, nose, throat, mouth, no problems. Cardiovascular. He reports having a fast heart rate at times and shortness of breath. The pulmonary, he reports shortness of breath at rest, laying down, minimal exertion, and moderate exertion. He's coughing up green to gray sputum. It says he does hear some wheezing at times. He did ask for prednisone when he said that. Gastrointestinal, he reports bloating and constipation. Last bowel movement was 2 days ago. GU, he reports little to no urination, and he reports a swollen scrotum with a rash underneath the scrotum. Musculoskeletal reports that he has muscle loss to the upper extremities and upper back, and he has some pain in his knees. He has dryness of integument. He has dryness of the skin and the rash under the scrotum. Neurological, no issues. Psychiatric, no issues. Endocrine reports excessive thirst. Hematological, no issues. Vital signs, blood pressure 158/88, pulse 94, respiration 22, temperature 98.0, O2 sat 94%, room air, height 5'7", weighs 203 pounds, and is a BMI of 31. His physical assessment, general appearances, he's well dressed, well groomed, speaks well. Head, eyes, ears, nose, throat, neck, mouth, no problem. Sclera are white, a pink conjunctiva, mucous membranes are fine, oral mucous membranes are fine, no problems. His oral cavity is pink, his gums are pink, no bleeding or anything. Not oral mucous membranes, but nasal mucous membranes, sorry. Cardiovascular edema noted from his stomach all the way down to his feet at 3+. Shortness of breath at rest. S1, S2 is auscultated, but there are arrhythmias heard upon auscultation with my stethoscope. Pulses are weak, ×4. Cyanosis noted in bilateral hands and all fingers. When he laid down for us to assess his abdomen, his fingers turned blue. The peripheral refills are slow in his fingers at 3+. Respiratory status even, breaths are even, uneven, and labored. Wheezing auscultated throughout the lungs, crackles noted throughout the lungs, and he is shortness of breath. He did cough up some sputum of dark to gray color when he was there, more like greenish color, more so than the gray. Abdominal, he had a fluid shift when we auscultated his, when we palpated his stomach. No aortic pulses could be palpated, and he had hypoactive bowel movements. Couldn't really feel any organs or anything due to the edema. Neurologically, he was fine. Psychiatric, he was fine. Assessment, we had so many diagnoses because we couldn't just come up with one. So dehydration, heart failure, either pulmonary edema, maybe pulmonary embolism, kidney failure such as nephrotic syndrome, hepatic failure could be going on. So we sent him over to the hospital due to the level of symptoms and the uncertainty of a definitive diagnosis. We agreed if we stayed with the patient and he wasn't having distressful symptoms. So he was in distress when he was there, and it was he needed to go to the hospital. But if we could treat him, things that we would look out for are we would check his blood glucose in the office and make sure that his blood sugar wasn't high, because you also want to check EKG to make sure that for the arrhythmias and see what's going on with that. Lab work can be done: CBC, CMP, cardiac enzymes, lipid profile, liver function studies, thyroid studies, and A1C. Urinalysis can be done: CT scan, ultrasound. If we were to prescribe something for him, you'd want to get rid of the fluid. So Lasix would be your first choice to get rid of it really fast. So 40 milligrams of Lasix twice a day for a few days to get it down, and then wean him to a lower dose. Breathing treatments to help open up his lungs so he can breathe. Give him an intensive spirometer to take home. Prescribe a Medrol dose pack. Prescribe a Z-Pack due to the infection. You'd want to get a sputum as well, a sputum sample to see what kind of bacteria it is so we can treat it appropriately. The blood pressure meds would be prescribed with a diuretic, so hydrochlorothiazide would probably be good for him, starting at 25 milligrams twice a day. Flomax could probably help with the urine at 0.4 milligrams daily. Definitely a nystatin cream and powder can be used under his scrotum to help with the rash and the redness that's under there. We want to mention lifestyle changes for him, such as a better diet, exercising, definitely the foods he's eating, and ensure that he's following up with his physicians and get his preventative checks done. I would definitely want to see him back within a couple of weeks to see how he's doing. Within 2 weeks, just to, after the Medrol dose pack and the Z-Pack and things like that, to see if that has helped him, or have him call me to let me know what's going on. And I would probably call him within 24 hours anyway, to see how he's doing, if he got the meds, and if he's feeling a little bit better. I still want to check up on my patient after that. but we did send him out to the hospital. So even though we came up with all these differential diagnosis, I'll tell you what the diagnosis was. The doctor called me the other night after he went to the hospital, and he has myxomas tumor. So it's myxoma. It's a non-cancerous heart tumor. So when he did go to the hospital and they checked his ejection fraction, it was 5%. So he needs a heart transplant. At the end of all this, he needed a heart transplant, and they transferred him to the University of Miami. So hopefully we'll see him again, and he will be doing better. And another plan and another diagnostic is to, aspiration of the fluid out of the stomach as well when he goes to the hospital. So I know this is over 8 minutes. I'm so sorry. My references are the Merck Manual, Myxomas, by Dr. Rao. Also, What is Heart Failure from the American Heart Association 2021. What is Acute Liver Failure, and that's with the Mayo Clinic 2021. And also Kidney and Renal Failure by Dr. Dr. Wedrow, 2/12/2021. So thank you for listening. If there's anything I need to add, take away if I said too much, I'm okay with constructive criticism. Help me make my soap note perfect. Thank you all for listening to me. Have an amazing evening. Bye.